Hello everyone, my name is Julianne Gallego and I want to welcome you all to my final presentation video. Thank you for viewing this and I hope you enjoy it. In this presentation, we will discuss and reflect on my practicum experiences. The topics to be discussed include practicum site and organization, a needs assessment, project topic, project goals, and project outcomes. There will also be a discussion on how the stakeholders received my project, how this project was implemented, and how it will be sustained, and also how it will be handed off after my departure when this practicum is over. I will review my professional goals that I set for myself and the AONL competencies that I hope to accomplish at the end of this practicum. Lastly, I will discuss what I learned over the past few months at my practicum site. So my practicum was done at Stony Brook University Hospital, which is a Long Island premier academic medical center. With 624 beds, Stony Brook University Hospital, also known as SBUH, serves as the region's only tertiary care center and regional trauma center, and it is home to Stony Brook Heart Institute, Stony Brook Cancer Center, Stony Brook Children's Hospital, and Stony Brook Neurosciences Institute. The Heart Institute at Stony Brook houses some of the most skilled interventional cardiologists as well as cardiac nurses. My preceptor, Kelly, is the clinical nurse specialist for the cardiac cath lab as well as the cardiac holding area. My preceptor's job includes overseeing all policy changes and recognitions, education, chart auditing, and many other aspects of nursing. Joint Commission reviews or revisions, as well as making sure staff are up to date on competencies and compliance, as well as general overseeing of a brand new electronic medical record system that is being implemented. So, needs assessment. A needs assessment was done prior to starting my project to ensure that the project is well aligned with the stakeholder needs, the objectives are clearly defined, resources are allocated efficiently, risks are considered, solutions are tailored to identify needs, and project impact can be effectively measured and evaluated. When meeting with my preceptor, we initially discussed requirements, due dates for my project. She and I also discussed the recent Joint Commission visit and the outcome of said visit, and immediately agreed that the need to address the Joint Commission is what my project should be. The Joint Commission is the accrediting agency that Stony Brook uses, and upon their most recent visit, they discovered that charting of vitals post-sedation, as well as post-Aldrete scoring, was not being met to the standards in which they have been set. Even with the explanation of a new EMR system in place, they still put fault on Stony Brook and wanted a solution for how this would not occur in the future. My preceptor and I quickly realized that the staff needed to be educated on the use of conscious sedation by the non-anesthesia person, which means just anesthesiologists are not on site. These are nurses that have been trained in using sedation. The importance of documentation and where to find the policies to address this. I suggested that we carry out an education day, which would essentially work with the department educator on the needs of the stakeholders, in this case, the nurses, in order to identify weakness and provide education. We quickly identified a flaw within the new EMR system that was to be fixed in order to maintain automatic every 5-minute vital signs to be charted. A PowerPoint would be used to educate the staff, as well as a way to chart audit in order to make sure that positive progression was being made as per the Joint Commission revision plan. Project topic. Based upon the initial assessment of the staff with a pre-quiz, it was determined that a PowerPoint on the use of conscious sedation by the non-anesthesia person should be done. The use of the pretest was just to get an initial assessment of how much the staff knew about the importance of conscious sedation, the objectives of conscious sedation, the different medications used for sedation, the synergistic effects of these medications used in the cath lab, the high-risk patients that come to the cath lab, and how sedation can affect them, interprocedural monitoring and the necessary components of that, importance of Ramsey scoring, and post-Aldrete scoring, complications of sedation, and lastly, where to locate policies for conscious sedation on the Stony Brook University Hospital website. Their PowerPoint presentation touched upon many topics. A post-quiz was provided and a question session was allowed to commence. Providing the staff with screenshots of the new EMR where important charting was being missed so they can see in real time allowed for the stakeholders, in this case the nurses, to see where their errors were being made. The goals of this project was to bring awareness to the importance of documentation errors while charting in the new EMR, teaching the importance of conscious sedation, what medications are used in the cath lab, and how those affect the general population of the patients in the cath lab was necessary in the teaching a baseline understanding. The goal of this project was to provide all of the needs and answer any questions to the stakeholders based off the original needs assessment. I wanted to make sure that all the information that I provided the stakeholders was accurate and up to date. The hope of this project was that the stakeholders, in this case the nurses, would come to understand the privilege it is to be able to give sedation as a non-anesthesia person and maintain the credentialing requirements as well as the proper documentation it takes to uphold that privilege. Project outcomes. According to the original timeline, the presentation for conscious sedation got delayed a couple of times due to scheduling conflicts and also emergency codes that happened in real time in the cath lab. Eventually, we were able to coordinate multiple days to utilize the conference room where I was able to deliver my presentation and have an open discussion with the staff. I think this ended up being successful in the respect that we were able to open the dialogue to the staff needs. They were able to voice their concerns over the new EMR system and how things might not be working for them. It created a few takeaways from my preceptor on how she could work with the IT staff to make sure changes to the EMR documentation system happened. The post-education quizzes proved to increase knowledge amongst the staff immediately. I noticed the next few days on site that the staff was more aware of the charting they were putting out, making the necessary changes right away, and took criticism very well. The overall compliance of the charting increased from around 72% compliance to around 91% compliance within the last week of chart audits. The goal for Joint Commission was around 90% compliance with an in-house goal set at 95%. Stakeholder support. The stakeholders were very receptive to the guidance and education they received regarding the proper documentation needed to meet Joint Commission standards. Many of them had great questions and suggestions on how making the EMR a little more user-friendly could also help regarding some of the charting errors. My preceptor took most of these suggestions and reached out to the IT people to see if they could make those changes. The overall support I received from the stakeholders led to positive changes and an increase in the knowledge and the use of conscious sedation in the cath lab. The needs assessment helped to understand what topics would need to be covered, and through the education session, we were able to tackle so much more. Project sustainability. The Joint Commission recommendations for proper documentation will be enforced permanently going forward. Any updates were made to the Stony Brook policy by my preceptor regarding what is deemed necessary when a patient receives conscious sedation medication. It is important for the staff to adhere to these guidelines as a means not to needing an anesthesiologist for every single case being done. Proper documentation not only keeps the patient safe, It also protects the staff from having liability if something were to go wrong. Changes that were brought up during the education session were brought to the IT department to see if they can be made in the EMR system. It's important to note that not all changes could be made, but that most of them were simple fixes, which then in turn did make the charting easier for the staff. Project handoff. My preceptor and I agreed on the fact that she would be the one to take over this project when I was done with school. This was discussed in the planning stage. Going forward, she would continue the chart audits necessary to create the feedback needed for stakeholders. This would allow for her to make any changes that she thinks would be necessary, as well as re-educate when needed. Professional goals set. And AONL competencies achieved. Setting clear and specific goals is crucial to guiding nursing projects, ensuring focus, measuring progress, motivating stakeholders, allocating resources effectively, and fostering accountability, aligning with stakeholder needs, and promoting continuous improvement. I set my professional goals prior to starting my practicum, and they included gaining hands-on experience, developing leadership skills, effectively managing healthcare resources, learning more about quality improvement and professional growth. I do believe that these are things that I will carry through my career. While I am not perfect at them now, I do think that it is something that I gained from this experience with my preceptor. AONL competencies included professionalism, communication and relationship management, business skills and principles, and knowledge of the healthcare environment. While working in healthcare most of my life, I do think that I carry most of these competencies. I am not a master at them, but they are certainly something I will carry through the future into my own leadership when I enter the workforce. I learned so much from this project, and I cannot thank my preceptor enough. She was so knowledgeable. She is involved heavily in things in this facility. She taught me so many things about leadership, what makes a great leader. She allowed me to use critical thinking that I wasn't even aware that I had. I do think, involving myself in the education of this allowed me to open doors for myself as a leader. Public speaking isn't always something that I'm great at, but it's certainly something that leaders always need to work on. So I do think that that education session and having to do it multiple times allowed me to touch upon perfecting that skill. So this project was very helpful. And I can't wait to get out there and use some of the skills that I learned from Kelly. She was amazing. I just want to thank everyone for listening to this presentation, and I hope that you learned something from it.